As nurses, we have all dealt with patients who have urinary catheters, whether that's an indwelling urinary catheter or suprapubic catheter, or a patient who needed intermittent catheterization. We've all dealt with these patients. But do we know the harm that indwelling urinary catheters can cause patients, or how to prevent it? CAUTI, or catheter-associated urinary tract infections, are directly linked to indwelling urinary catheters. The Center for Disease Control and Prevention defined CAUTI as a UTI occurring after an indwelling urinary catheter has been in place for more than 2 consecutive days. The CDC also tells us that a UTI is caused by microorganisms entering the urinary tract. These microorganisms can come from the patient's own body, from a healthcare provider's hands, or from the equipment used. But why is CAUTI such a problem? Well, according to Ferguson, in her article, she wrote that CAUTI is the 4th leading cause of hospital-acquired infections. Not only that, but approximately 13,000 deaths are attributed to CAUTI thus far. Also, CAUTI is the primary cause of secondary bloodstream infections. This is a huge problem for our patients, but what about the hospital system? Well, for every patient that is diagnosed with CAUTI, it costs the hospital approximately an extra $758. Also, there is no hospital reimbursement for CAUTI. Not only that, but up to 69% of CAUTI could have been prevented. Obviously, this is a huge problem, but how does this affect nursing? Well, as nurses, we are the ones who insert, care for, maintain, and remove catheters. And when we are not doing these things, we are delegating these tasks to other qualified healthcare professionals. Not only that, but we advocate for our patients. We advocate when we believe that a catheter is needed or when one needs to be removed. Ultimately, we are the ones who are caring for these patients, and if these patients have a lengthened hospital stay due to CAUTI, that is an extra burden on nurses that could have otherwise been prevented. We need to take the risk of CAUTI seriously when dealing with indwelling urinary catheters. The Centers for Disease Control and Prevention, or the CDC, has developed 6 guidelines for preventing CAUTI. This is the CAUTI bundle that we'll be looking at. They developed this because of the problem that CAUTI is to patients and the hospital care setting. There are 6 components to the CDC CAUTI bundle: indications for catheter use, catheter insertion, catheter maintenance, quality improvement programs, administrative infrastructure required, and surveillance strategies. The goal of the CDC CAUTI bundle is to reduce, if not totally eliminate, CAUTI from the hospital setting. We'll be looking at this in depth as we go throughout the presentation, and we'll be looking at some research done on the CDC CAUTI bundle. First of all, let's look at the first indication. Who should get an indwelling urinary catheter? Well, the CDC recommends that patients who have acute urinary retention and who have a bladder obstruction should receive a urinary catheter. They also tell us that patients who need strict I&O counts should also get a catheter. Catheters can also be used for certain surgical procedures and for patients who need wound healing to be promoted. They also can be used for patients who are immobile for a prolonged period of time, and they can also be used for end-of-life care. The CDC, however, does not recommend using catheters as a quick fix for patients who are incontinent. They also don't recommend using indwelling urinary catheters solely for obtaining a urine specimen. They also do not recommend using them for a long time post-operatively without other proper indications. The next part of the CAUTI bundle is catheter insertion. The CDC says that hand hygiene is crucial to preventing CAUTI, and it should be done before and after catheter insertion. The CDC also tells us that the healthcare professionals that will be inserting catheters need to be properly trained before doing so. They recommend using aseptic technique when in the hospital setting and clean technique when not in the hospital setting. The CDC also recommends using appropriate securing devices for catheters and using the smallest bore catheter unless otherwise indicated. The CDC recommends using intermittent catheterization for patients who need it, but doing it at regular intervals. They also mentioned that using ultrasound bladder scanners might be helpful in determining if the patient needs a catheter at all. The next part of the CAUTI bundle is catheter maintenance. The CDC recommends using a closed drainage system, preferably a catheter and a drainage system that has already been pre-connected before insertion. They also recommend unobstructed urine flow after a catheter has been inserted, so to make sure there are no kinks in the tubing after a catheter has been inserted. The CDC also recommends using appropriate PPE whenever dealing with any part of the catheter, whether that's just gloves or having gloves and gowns. The CDC also has recommendations on when to change a catheter. If the catheter becomes obstructed or the bladder becomes obstructed and the catheter might be the problem, the CDC recommends changing a catheter at that point. They also recommend changing a catheter if there's an infection, a break or a leak in the system, or another type of obstruction. The CDC does recommend that we continue providing hygiene for our patients who have indwelling urinary catheters, but they don't recommend using aseptic technique when providing perineal care for our patients, or using antiseptics in general when providing perineal care for our patients. The CDC also recommends obtaining a urine specimen aseptically whenever getting one off an indwelling urinary catheter. This is to help our patients not have a UTI by introducing microorganisms through the port. Other areas that the CDC recommends exploring when we talk about catheter maintenance are the benefits of catheter valves, or irrigating the bladder with acidifying solutions to resolve bladder obstructions, or using ultrasounds to further assess bladder obstructions. The next part of the CDC CAUTI bundle are quality improvement programs. The CDC recommends having quality improvement programs in addition to the CAUTI bundle to help hospitals integrate the CAUTI bundle in their facility. The purpose of quality improvement programs are to make sure that catheters are used appropriately, that they are cared for appropriately, and that they are taken out when they are not needed. Examples that the CDC has for quality improvement programs are reminders to reassess patients who have your indwelling urinary catheters to determine whether or not they're needed, guidelines for removal by nurses or nurse-directed removals, algorithms for perioperative use, and alternative ways to relieve bladder distension post-operatively. The next part of the CDC CAUTI bundle is administrative infrastructure required. The CDC believes that the administration should oversee and provide supplies to the staff. They believe that the administrative infrastructure is responsible for presenting the guidelines of the CAUTI bundle. They also believe that the administration is responsible for educating and training healthcare professionals in this CDC CAUTI bundle. The CDC also believes that the administration should provide resources so that the staff can appropriately care for patients who have indwelling urinary catheters. They also believe that the administration should provide a documenting system so nurses can document their care for their patients appropriately. In addition to these things, the CDC recommends that the administration also provides resources for surveilling the CAUTI rate and how nurses are using the CAUTI bundle to see if they're using them appropriately. And that leads to the last part of the CDC CAUTI bundle, which is surveillance strategies. The CDC has specific indications for surveillance. They do not recommend screening everybody in the hospital, but those who have a catheter and who are at risk for CAUTI. Another part of the surveillance strategies are standardized methodization or standardized methodology. The CDC recommends measuring CAUTI occurrences or CAUTI rate by the number of CAUTI per 1,000 bed days of care, or CAUTI days. The CDC also recommends that the administration give feedback to the staff so that they know that what they're doing is actually working, or if they need to improve in one area or another. One specific thing that the CDC does not recommend screening for is asymptomatic bacteremia in the hospital setting. So now that we've looked at the CDC CAUTI bundle in depth, let's look at some of the research done on the CDC CAUTI bundle. First of all, we have Annette Ferguson. Annette Ferguson educated on the CDC CAUTI bundle prevention guidelines, and she did this on a telemetry floor and neurotrauma intensive care unit. And during this study, she analyzed the CAUTI rate pre and post education. As you can see on the telemetry floor, the CAUTI rate was 7.49 pre-education, and post-education, it went down to 0. Also on the neurotrauma ICU, the CAUTI rate pre-education was 4.12, and post-education went down to 1.56. Another study we looked at was done by Diana Carlson, and she also studied how educating nurses on the CDC CAUTI bundle affected CAUTI rates. She did this with 33 nurses in a long-term health care facility. She recorded and analyzed the CAUTI rates throughout the study as well. Before education, you can see that the CAUTI rate was 6.06, and post-education, it went down to 0. Alexandra Carr and her colleagues also studied the CAUTI rate, but not with CAUTI education. Instead, they implemented the CAUTI bundle on a progressive care unit. She studied the effect that this bundle and other quality improvement programs had on the CAUTI rate throughout her study. Before implementing the CAUTI bundle, the CAUTI rate was 5.08, and after implementing the bundle, the CAUTI rate went down to 0. The last study we'll look at is done by Lindsay Underwood. Lindsay Underwood implemented the CAUTI bundle as well as other quality improvement programs. She studied the CAUTI rate on a neurosurgical and neurological ICU. So pre-implementing the CDC CAUTI bundle, the CAUTI occurrence rate, not the rate, but how many CAUTIs there were 21. And after implementing the CAUTI bundle, the CAUTI occurrence went down to 17. So a 19% decrease just attributed to using the CAUTI bundle. So after looking at this research, how will this CAUTI bundle affect nursing and nurses in general? Well, hopefully, and obviously, we're aiming to change the way nurses deal with catheters. We're hoping to improve the way that nurses care for their patients and insert, maintain, and remove catheters. Our goal is to reduce, if not totally eliminate, CAUTI from the hospital setting. Hospitals should implement this bundle as soon as they have the means and resources to do so. Although we recommend implementing this bundle before hospitals have a problem with CAUTI, it is not likely they will see the need for this until after they do have a problem with it in their own facility. So what is our goal with this CAUTI bundle? Well, our ultimate goal is to prevent CAUTI from being a problem at all. But if CAUTI is already a problem in a healthcare facility, our goal is to reduce, if not eliminate it, from that facility. We obviously do not want our patients to have to deal with CAUTI. Our goal is to reduce costs to hospitals and to have healthy patients, improving patient outcomes. Now, I've given all of you a pamphlet that highlights the CDC CAUTI bundle, and you can refer to it after this presentation is over to look at the highlights that we've talked about, and hopefully so that you can implement this in your own healthcare facility. Thank you.